This being a December month and is also known as a Constipation Month, we have invited Dr. Saumil Shah, is a gastroenterologist practicing at Criticare Hospital and Nanavati Hospital.
That's right. Yeah.
Right. So, Dr. Saumil, we wanted you to throw some light in wake of this Constipation Month.
So first of all, being a gastroenterologist, I never really knew that December is called as a constipation month, which is an actually surprise for me. I'll have to actually just go and check it up why it's called as a constipation month. But yeah, it's something new for me. I think constipation, unfortunately, is a problem which lasts throughout the year for most patients. So I don't think so we can give really a month to a particular problem. But
maybe
that's okay.
Probably in winter season people are drinking less of water, and because they're drinking less of water,
possible. I mean, that's what I said. I'll probably just check this out and probably see what is the reason, because I think this terminology would have come from the West, and in the West they have winter starting from September almost going on till March. So I'm really not sure why they have really picked up December as this. For me, December should be Christmas month. I think we'll keep it at that.
Great. So let's come back to constipation, Saumil. What do you mean by constipation? Passing hard stool straining is constipation, or not passing motion at all is constipation?
So the standard definition of constipation would be passing less than 3 stools in a week. That is the standard definition. Again, this definition has come from the West. So in Indians, since our diet is very rich in fiber, I would say probably not passing stools for about 5 times in a week, or probably lesser than that would be considered as constipation. However, that is not the only thing which a patient would come to us with constipation.
Okay.
Patients will also say that they are straining a lot while passing stools, which is also considered as one of the parts of constipation. They are passing very hard stools, and very hard stools can itself be defined as constipation. There are many people, especially in India, who have incomplete evacuation of stools. What I mean by that is that patients pass stools every day, but they are not satisfied at the end of passing stools. And then they would need to go probably 2 or 3 times to pass stools every day to really clear their bowels. And this is also considered as constipation. So the definition of constipation can be extended to all these parameters which I have mentioned. And the contribution of all these 4 factors would end up eventually defining constipation.
I think you answered it, but just to make it more clear, because patients do feel that a mental block that they have to pass motions every day. So my clear-cut question next was like, is it necessary to pass motion every day?
Absolutely not. There are many people who would be passing stools on alternate days. And as I said, according to the definition, passing 3 stools in a week is also considered as normal for many. So it is not mandatory to pass stools every day, and every human being has his own cycles of passing stools. So someone might be passing stools every day for years, suddenly does not pass and passes alternate days. I will consider that constipation. Okay. But someone who's been passing stools alternate days probably for years together, for him this is normal. So you should consider this as normal.
Okay. Right. And what do you feel? Does constipation has a genetic or a gender? Do you feel females are more constipated than males, or just because father was constipated, the son is constipated? Do you have any genetic or gender preponderance?
So gender preponderance, yes, in the West, again, literature shows that it's more preponderance in women or females because of several reasons. But in India, things are a little different, because unfortunately, if you would see most of the studies which are being done in India, the number of people who actually end up going to doctors, the men proportion is more than women. And that's the reason, if you would see the data coming from India, it mentions that Indian men are probably more constipated than women. But this actually might not be so, because there is something what we call as a health-seeking behavior. And the health-seeking behavior in India is a little different. It is basically seen more in men as compared to women. So if you ask me, I would say it is common in both the genders, but probably in India we see more men. However, it is a combination. I mean, we would see in varying populations, even women being significantly constipated. Coming to the genetic part of it, no, I don't think so there is any genetic preponderance to leading to constipation, but it's usually based in families that their diet are similar, their lifestyle activities are similar, the way, so that is the reason, the amount of water which they would be drinking, the fiber which they would be eating, and that varies from families to families. That's why you see a lot of people in the same family having similar symptoms, but that is more related to the diet. It is not because it's a genetic consideration. There are a few genetic diseases which can come with severe constipation, but that's an extremely rare form of constipation.
And besides this, does diabetes, or people say that hypothyroid, diabetes, or anti-anxiety pills or bronchodilators in patients with asthma, have you seen constipation being more with them?
So the diseases itself cause more constipation than the medicines itself. So to give you an example, patients with diabetes and thyroid or hypothyroidism specifically
True.
are the people who would be having constipation, because there is significant dysmotility, what we say, that is the intestines don't function normally. It is not the medicines which is causing the problem, it's the basic disease. In fact, there are many medicines in diabetes which we give which actually end up causing diarrhea more than
Yes.
constipation. The same way in thyroid, the thyroid medicines don't cause constipation. So what we are looking at is we are looking at the disease which causes constipation. Now coming to anxiety. Anxiety medicines per se are not significantly, they don't significantly cause constipation, but antidepressants, antipsychotics, they have more, the drugs itself will cause significant constipation. So since we are discussing about anxiety, depression, probably one of the most common causes of constipation which we would see would be irritable bowel syndrome, and that's a disease which is more commonly seen in this group of patients who have underlying psychological or psychiatric diseases and who are on medicines, which makes things worse. Coming to asthma, yes, there are certain drugs, especially theophylline, which can occasionally cause constipation. But the routine medicines like inhalers and all that would not cause constipation. And along with that, asthma per se does not really affect the gut. So I don't think so there is much of this. So it is the disease, it is the drugs. You have to look at the whole picture, and then probably you need to come to a diagnosis at the probable cause of constipation in that particular group of person.
And many people asking me that does when a female is into his menses, does menstrual cycle itself also cause constipation?
So it does cause, because at this time there are hormonal changes happening in a lady, and the usual hormone which causes constipation is progesterone. And at the time when the menses is going on, that's the time when progesterone is usually at its peak or just pre-menses. So yes, there are many women who would specifically have constipation at the time of their menses, but that's usually transient and it's related to hormones.
Okay. Now, as a surgeon, I always feel that Indian toilet is better than the Western toilet. Like, because they say for ergonomics, when you are squatting and putting pressure, and the curvature of the rectum becomes a more straighter, and then all those things. So, do you feel that for better ergonomics, Indian toilet is better than Western toilet?
You are absolutely right. Basically, our last part of our large intestine is S-shaped. So when you use the English toilets, or the way which unfortunately most of us are using, the S-shaped remains S-shaped and it doesn't straighten up.
Okay.
And that's the reason we see that the Westerners are more constipated than Indians.
Okay.
And the reason is because when you squat, at that time your intestine, that is a distal part, that is the sigmoid colon and the rectum specifically, they become relatively straight, which helps in better evacuation of stools.
Okay.
But as I mentioned, that now we are all following the Western culture. So the problem, as I said, is because of we use the Indian toilets, we are able to evacuate more completely as compared to the Western population, which use the English type of toilets, where you are not squatting but you are sitting, and there the intestine doesn't straighten. So yes, Indian toilet is the best way of passing stools, but unfortunately, in now even in most cities, we don't have Indian toilets at all. Most of the people would be using Western toilets. So in normal people who are not constipated, it does not cause a great cause for concern, because it is something which they are now used to. It's now become physiological for
Exactly.
them. But in people who are constipated, along with your medical therapy, your diet, whatever else you're recommending, I do recommend them to use an additional stool which they should put under their legs and sort of elevate their legs to the best possible capacity. I would
Okay.
say probably a 1 foot, 1.5 foot
True.
stool size would be good, where they can actually, it sort of mimics the way you would squat.
Squat and
And
sit. Yeah.
especially elderly people who are not able to sit down, It's not very comfortable after the age of 45,
Yeah.
50, when you probably got joints which are a little getting a little osteoarthritic or a little weak. From that point of view, it might be better that you use this tool, which will probably make you pass better. So don't stress just on medicines alone.
Okay.
Also try to stress on this as one of the medical methods.
Elderly people, as you said rightly, that they have osteoarthritis, so we try to keep a stool of around 1 feet and then try to have this bend across.
Yeah.
Fine. As a surgeon, I get a lot of piles and all, and they always feel that because of piles they're having constipation, but it's obviously the other way around, that constipation is causing them piles and fissures. So what laxative or stool softeners would you recommend that they would take it lifelong and they can safely take lifelong?
So the first concept I would like to make it clear for all those who are hearing is that hemorrhoids or piles are normal blood vessels supplying that local area.
True.
And when they are present over there, they cause no problems at all. That is a normal venous supply of that area. But when you keep on getting constipated, you are straining again and again and again.
Yes.
That is the point when these hemorrhoids, they start getting engorged and enlarged, and then probably obviously get inflamed, infected. Then the problems start when they start bleeding or they start prolapsing. That is a disease. So just the
Okay.
presence of hemorrhoids or piles is not a disease, that's normal.
Normal.
Now, coming to long-term laxatives, the first step in most, what I would recommend is you need to improve your diet, where you need to have adequate fiber in your diet. You need to have at least 12 to 14 glasses of liquids every day. That would be equivalent to about 2.5 to 3 liters, which is mandatory for a person who's constipated, unless there are medical reasons where you need to have less fluid or less fiber for
Restriction
any
and all.
reasons.
Yeah.
Now, coming to medicines, which would be the third thing which I would probably come up to. The safest of the things, basically when we are talking about laxatives, we divide them into groups. So that is what we call as bulk laxatives. We have got
Okay.
osmotic laxatives,
Right.
and we've got stimulant laxatives. And now we have got a newer group of laxatives which work on specific receptors.
Okay.
Now this is too much of a medical talk for most people to understand. So let's make it a little simple. The safest laxatives would be a fiber. And the most common fiber available in India is satisabgul or
Satisabgul.
psyllium husk, what we call it.
Okay.
It is also available in the West in different forms, and there are other brands or other molecules also available. But the standard one available is psyllium husk, which is the safest, and if required, can be taken for the rest of your life.
Okay.
But there are many other osmotic laxatives also, which can be taken for long. For example, there is something called as lactulose or lactitol, as well as polyethylene glycol.
Okay.
Now, these are good laxatives and can be taken for years together. Most of the data which we have using these laxatives have not shown to cause any harm. But there is a group of laxatives called as stimulant laxatives,
Like
which
the
basically,
Dulcolex
like
tablets and
Dulcolex, or
Horlicks
like we are talking of
Okay.
Dulcolex, we are talking of Cremalax, we are talking of Cremafin Plus. I'm naming a few brands specifically because these are the common brands available.
True.
But these stimulant laxatives, when taken for long, can actually cause a problem. So that is something which you need to be very clear with what you are doing, and probably use these medicines judiciously, specifically after consulting your doctor. So don't take these medicines unnecessarily. And one thing we need to understand, that although constipation is a very, very common problem, and most of the patients would not have any severe or significant disease, there would be some people who would be coming with constipation, especially someone who's had a recent onset constipation or a new onset constipation, or someone who's having blood in stools,
Okay.
or someone who's now losing weight, or someone who has a family history of cancers. These are the patients you need to be a little watchful about, and think of evaluating such a patient before you decide to put them on long-term laxatives. It should not end up being that you end up missing a disease.
True.
Because you've just given medicine and you're just trying to suppress the symptoms. That's all.
You mentioned sorry. You mentioned about the laxatives taken lifelong. What is your take on usually females when they are pregnant? They are also getting constipated. So are these safe during pregnancy?
They're all, the three molecules which I mentioned are all safe. So the
Can you
usual
just
choice.
tell us?
So for example, satisabgul would be reasonably safe. Lactitol or lactulose would be safe. Polyethylene glycol is also safe. They have been used in pregnancy. However, my first go-to choice in this situation would still end up being a lactulose or lactitol, because they are a little more easier to tolerate by pregnant women. However, there are situations when we would end up going to polyethylene glycol, or even rarely even isabgol. Isabgol, because it's a fiber, can sometimes be uncomfortable for someone who's in the third trimester, because the uterus has enlarged so much that it is actually pressing on the colon, and
Colon.
sometimes the bloating which is created by such
The you.
isabgol is a little more, which can make them uncomfortable.
Okay.
So that is not my first drug to, but if required, these three molecules are safe and can be easily given.
So many a times in my practice, when I write syrup Dufalec or syrup loose, patients start, oh, it's very sweet. Will my sugars get affected? So, is there any kind of laxatives which are not supposed to be given for diabetic patients because of it, because they are sweet, or what is it?
So the dose which we are giving in most of these patients is about 25 to 30 ml, and the amount of sugar which is there is too minimal. Yes, it is obviously, it tastes sweet, but the amount of sugar is hardly there, and it does not really impact your sugar. So if patient says that my sugars have gone up because of these syrups, they are wrong. When required, you can use that. However, as I said, there is another choice for lactulose that is called as lactitol, which is less sweet and probably a little more palatable to people who don't really like sweet things.
Okay.
So you can utilize that. Polyethylene glycol is also not sweet, so you can even utilize that. Again, even in isabgol, there are variety of brands available where they are associated with flavors, sweetness, sugars, without sugar. So you have a lot of combinations which you can use, or a lot of formulations available in the market which you can use, which are good for diabetics and non-diabetics. But the dose which you are using is so minimal that
That it
it
is not.
usually will not impact your sugars
Okay.
at all.
One last question, Dr. Saumil. I have seen many friends of mine, like they would say कि सुबह एक cigarette नहीं पिया तो potty नहीं आता है. You know, when this, like, they have to have a smoke to pass motions, or they have to sit in the loo pot with a cigarette. So, does cigarette avoid constipation, or what is the connection? I really don't
So
fail to
it's unfortunately a complete myth that smoking will make you pass stools better. It is unfortunately the addiction, and the you are basically used to smoking every day for years together, and that's the reason that misconception has gone in your mind. There have been studies which have been done with smoking affecting the gut motility, and it does affect the gut motility, but a cigarette, a single cigarette or a little nicotine will not cause anything to your bowels. So in my opinion, I would say it's a complete myth that you really require a smoke to pass stools.
I somehow, this is my logic. I just feel that if you just do a deep breathing exercise also rather than smoking, you will probably pass motion. It's probably when you smoke, you're just doing a deep breathing exercise.
Well, it's possible what you're saying, but if you say that a deep breathing exercise per se, I think any form of exercise itself in the morning where you're going to utilize, you are going to walk, even people who are constipated, if they start exercising regularly, even in those patients, constipation gets relieved. So it's a form of exercise which we are looking at, which is the important part. Deep breathing per se, there is again no literature or no sound proof I have which will say that it will impact your bowel
Ball
motility.
movements. Okay.
Uh, but as I said, it's a myth. So
Yeah.
I would not be able to postulate this as of now. I would say physical activities would be more important than just a deep breathing exercise.
So smoking and constipation or you is
It's
totally
absolutely not linked at all, and it should not be done. The harmful effects of smoking are much more
than
than your
constipation.
constipation issue. So I think you need to look at the harmful effects.
Thank you so much, Saumil. Would you like to say anything else to our audience?
No, I think constipation is something which is so common that everyone would face it sometime during their life. For most, it would be a very transient episode, but for many, it would be a chronic problem. Take the help of a doctor who is going to guide you properly with long-term medications rather than just taking medicines on your
Over
own,
the counter or
so
something.
that you don't end up missing something which is more
True.
important, and you are treated in the best possible way.
Thank you so much, Dr. Saumil,
Thank
and
you
we're
so much,
really
Hemal.
obliged to have you here. Thank you.
Thank you so much, Hemal.
Thank you.
Thank you.